The surgical procedure is monitored through a one-way mirror in the control room with real-time multimedia recordings for training and assessment. The operator can also control the mannequin's state and create and customize emergency scenarios.
Well, this is our control room. There's a one-way glass panel so that we can see what's going on in our simulated operating room. Our students on the other side of the glass can't see us, but we can control what happens in the scenario as things progress. We create these much as you would do a script for creating a film, where we can storyboard a sequence of events, and depending on how the students, how successful they are, for example, if an airway is part of the scenario, depending on whether they're successful in getting that, will change where the scenario goes. The other piece is that much of this is like improvisational theater. We never know exactly what our students, student actors may be doing, and so we have to sort of go along with the cues and can adopt or adapt to what is going on in our simulated operating room. Well, this is the computer that's used to control the mannequin, and you can select on different parameters, in this case the heart rate, and there's a fairly extensive panel of different patterns of cardiac arrhythmias. So I can just choose these and then apply them, and all of a sudden the heart rhythm here will change.
The Goodman Simulation Center also contains other robotic training devices like the virtual bronchoscope and colonoscope, and tools to train in laparoscopic surgery. These tools enable the user to get a feel for how the real instruments move when used in surgery.
So this is a virtual reality trainer similar to computer games, where they create foregrounds and backgrounds of what you might be encountering.
With your right instrument, touch the target.
So this is a way of practicing with laparoscopic tools. Laparoscopic surgery is minimally invasive.
Hold for 5 seconds.
Instead of making a large incision that you can visualize directly and manipulate with your hands, we're making incisions that are very small, maybe a quarter or half an inch in length, and then using tools that have these long sticks to enter the abdomen or wherever it is that the procedure takes us. This has many benefits for the patient. Smaller incision sites mean the risk of infection is less. The recovery time, the length of stay in the hospital is much shorter. The return to normal activity is faster, and cosmesis, that is scarring, is much reduced.
Hold for 5 seconds.
The trade-off is that it's much more difficult for the surgeon.
Left instrument, touch the target.
One of the things that happens when you're using long tools like this is there becomes a pivot point at the skin surface, and so when you move the handle down and to the right, the actuator, the tool end, moves up and to the left. So in order to master this, you basically have to learn mirror writing. Everything happens upside down and backwards. Now that's a learned skill, but it takes some practice. So this is the kind of training tool that surgeons can use on their own time in a safe environment before they actually get into the operating room with patients. There are 3 cameras inside this training phantom, this torso. One in each shoulder area and one down here in the suprapubic area. What it does is it looks for these strips of yellow tape, and as those are advanced inside this three-dimensional world, it can triangulate on them, and it knows what the position of the tools is within the three-dimensional space. It then superimposes that on top of the virtual endo world. So if you look inside this particular training phantom, it's empty. It's nothing but empty space. Tools. So this particular one is essentially a light source, a camera, and a box with some manipulatives. In this case we have colored shapes and some pegs, and the task is to pick up the shape with one tool in your left hand or right hand, transfer it to the other hand, and then move it to another peg.
Oh, okay. I didn't know about the transfer.
So this gives you a feel for what it's like to use the tools with these long extensions. The fact that you only have two-dimensional viewing of the camera view, so you no longer have binocular stereoscopic vision, you're reduced to a single 2D imaging view, and then further constrained by lack of a wrist and tactile feedback. What's going on?
I can do it with one hand, I just don't know how to switch that. The Goodman Simulation Center for Medicine and Training is a place of creativity and innovation where medicine can be taught, practiced, and repracticed. While this video illustrates the various simulation tools available for practicing surgery, it is important to acknowledge the limitations of the center. The simulations are void of blood and tactile feedback, making the experience less accurate than real surgery. The stress levels in the simulation room will also be lower, since residents know that the patient's life is not at stake. However, results show that surgical simulation is rapidly revolutionizing medical training and is a step towards future medical education. The development of new and better devices represent an ideal blend of engineering, education, and clinical practice. Indeed, Goodman Simulation Center sets a new standard for medical and surgical training.